Welcome to my clinic, Celevenus Wellness Aesthetic Clinic. We're here at Ngee City Tower B on the 16th floor. So, once again, welcome.
How long have you been practicing medical aesthetics?
Well, I've been practicing medical aesthetics for about 10 years now. And initially, I actually wanted to be an ER doctor. It's a doctor who specializes in emergency medicine. So after spending about 1 year at the A&E department, I realized that I don't have my own regular pool of patients. You know how it works, the A&E. You see the patient, it's either you discharge them or you put them up to the hospital or you refer them to a specialist. So I would like to have my own pool of regular patients whom I see year in, year out, whom I don't just treat but also come to know and be more personal with them. That's right, the personal touch, the rapport with my patients. So at the time, aesthetics was booming. There was much hype on Botox and fillers. So I was thinking, what are those things? So I actually tried them and explored them, and wow, the results were amazing. So I was instantly hooked, and I started exploring more. And being very image conscious myself, or just a little bit, it does help me in that respect, to be more suited in this industry. This is actually my main treatment room, whereby we do the major procedures, whereby we have all the machines here, like the laser machines, the ultrasound machines, and radio frequency machines, and as well as do all the injectables here as well, the needling work. So this room can be actually open up to look like a big one. Sometimes we may have, for example, hair transplant, we may need a little bit more space. So we may open it up or we can actually close it up. Two rooms. Sometimes we may have different doctors performing different procedures for different patients, so we may close it up. We have many machines here. Of course, some of the machines are in the rest of the treatment rooms. We have about 7 treatment rooms. But just to name a few, this is actually the Cyton machine. It is a machine that has multiple platforms. It has what we call the BBL module. The broadband line is one of the later generation of pulse line, and as well as it's also a laser machine. Most famously known for its micro laser peel. So which you use for treatment of like scars, and of course regeneration and rejuvenation of the skin. We do a laser peel. So this is actually Liposonics, one of the latest fat reduction machine that utilizes ultrasound, HIFU, which is high intensity focused ultrasound, to actually physically burn the fats. So this is actually the later generation of the March, the CPT, the March CPT. The March has actually evolved over the years. The March has been around for like 10 years. So every 3 years or so, they have a new latest version. So this is the latest one, whereby discomfort is being reduced much more compared to the older versions, and with better results, deeper penetration of the radio frequency, deeper heating of the skin. So, and this is actually Omnigraph, the one that we use to do hair transplant. And so this is actually a CO2 machine, CO2 laser machine, which is a workhorse. Well, it's used to burn a lot of things, maybe moles, or any lumps and bumps on the face, warts, or syringomas, things like that. So anything, or sometimes you even burn the media seeds. It's quite common with this. It looks very small, but actually, like I said, it's a workhorse. And this is actually what we call an air dissector. It's used to do what we call subcision. It's good for fine lines, pore size reduction, as well as the scar, to improve the appearance of scars. And over here we have the red light machine. Yeah, this is a laser. This is a Q switch ND laser. Yeah, its main purpose is to remove pigmentation, remove tattoos, and it's also very good for rejuvenation of the skin in terms of like pore size reduction, fine line reduction, and such.
So, what should a patient look out for when seeking a suitable medical aesthetic treatment?
Okay, like I've always told my patients before the procedure, usually 5 things to think about. One would be of course, the results. That's why they're here for in the first place. So as a physician, we'll ask them what do they expect out of the treatment, what the results they hope to achieve. And from there, we'll of course select the appropriate treatment that is best suited for the patient to achieve that kind of result. And sometimes results can come in terms of like percentage. We have to tell them like, okay, maybe 50% of it will be gone, or you will see 50% improvement, and also the number of sessions in order to achieve that kind of result. Maybe it's just 1 session, or how many sessions needed to achieve the results that the patient requires. And secondly, of course, things like the side effects and complications that may arise from the treatment itself, which is actually as important as the result. I mean, I have a personal so-called motto, that I always live by. We try to do some good, but at the same time, we try to cause no harm at all. So in fact, that should come first. We do no harm before we do some good. So of course, sometimes to achieve better results, more aggressive treatments have to be done, which carries a higher risk. So at the end of the day, it's a balance. So we have to actually discuss it with the patients. And thirdly, of course, the downtime. Whether there's any downtime associated with the treatment. The patient may have to plan way ahead before the treatment. Let's say a downtime of swelling and bruising, which takes about 5 days to resolve, and the patient may have to take leave or stay away from the public or from their husbands, for that period of time. So downtime is one thing they need to know. And fourth will be, of course, the pricing, the cost involved, which is also quite important. I mean, if something is free, I think people will be queuing up for the procedure. So they have to actually correlate the amount that they spend versus the results, and they have to make a decision whether it's worth it. And of course, I always advise my patient not to break a limb during a procedure. They must be comfortable, make sure that commitments elsewhere is so-called, settled and taken care of. And if they have some extra cash, of course, they can do something for themselves. Well, I guess when it comes to being different, it has to depend on the doctor's experience and the level of skill of the doctor, as well as whether the doctor have the necessary tools, to help to provide the results that the patient wants. So, like I said, I'm actually a sculptural trainer. So I train doctors regards to sculptural procedures, and in fact, we do a lot of sculptural treatment. And I constantly upgrade myself. I'm constantly on the lookout for the latest technology, the newest machines, so that I can provide better services and results for my patients. And over this place, like I said, I'm working with 2 other doctors. So we do have some form of like medical support, that we give between the 3 of us. So I have another aesthetic doctor working for us, as well as an in-house plastic surgeon. That would actually mean that we can provide a wider variety of services to better give the results for our patients. And being a good doctor, aesthetic doctor, will also mean that you have to be a good artist. It is actually combining science with artistry. So like I said, I'm being image conscious myself, and I think I have a good level of what beauty is. In doing the right kind of shapes and augmentation, and choosing the right appropriate treatments for my patients to achieve the results that they want. So every doctor, the difference between all of us will be choosing what kind of treatments that we choose for our patients. And so I think so far most of my patients are very satisfied with my treatments and our services as well. Not to mention, that's another area that we are very good in. That is our services. Like my staff are all well trained. Actually, I've got 4 staff who are ex-crew members. So they have been trained by the airlines. There's no need for me to train them that much. They know what service is all about. So we live by what SIA has. There's a service over and above the rest. So I'm sure that if you have to come here, you would feel that from us, the level of service from us. So that's probably what sets us apart.